Welcome back. Okay, you can answer this question or not. And then let's do this. And then use the white color as the background. The background we think about is as the transverse fissure. And then drawing the structure, like change the color, let's see here. And this one, the anterior superior iliac spine. And then this one, the pubic symphysis. And then the pubic tubercle. The between them as the inguinal ligament, and then the transverse muscle. The transverse muscle, we utilize the blue colors to show it. It's origin from in the direction, the later 1/3, and then it terminates to the pecten of the pubis, and then this fiber is terminated to here. Let's see, to here, and then utilize the pink color to show the oblique internus abdominis, later half of the inguinal ligament is here to this part. And then, so let's say this inferior free border is from the superior wall of the inguinal ligament. And then this one, the background of the transverse fissure is from the posterior wall. And here, this part is from the posterior wall, participate formation of the posterior wall. And then the anterior wall, let's say, utilize the red colors in the direction, and then in the direction. And then here is from a superficial ring, and then the deep ring from the transverse fissure. The transverse fissure we utilize here, the deep ring. So let's say 1, 2, 3 ring, the inferior wall, the superior wall is here, and then the posterior wall background, and this one, the anterior wall, and this one, the transverse, the oblique actiners. Let's say, repeat it again in the picture, let's see. And then this background as the transverse fissure. The anterior superior iliac spine. And then this one, the pubic tubercle. And then pubic symphysis, the pecten of the pubis. And then the aponeurosis of the transverse abdominis. I use the red colors between them. And then some fibers to here, like this. And then some fiber to the pubis, pubic symphysis. So in this part, from the superficial ring, and then this one is the inguinal ligament. Let's see, it's second, the inguinal ligament, and here. The inguinal ligament. And then the transverse abdominis, the blue color, is the later one-third of the muscles, let's say, is to the median, yeah. And then the fiber is from this direction is descending, like this, is descending. And then the oblique internos abdominis is from the later half, from this direction. And then this one, the free border of the transverse abdominis and the oblique internal abdominis of these two muscles is from the superior wall of the canal. And then this one, the posterior wall, the white color background, the transverse fissure must plus this structure, the conjoined ligament. And then the anterior wall is this one. This, the aponeurosis of the obliquus actinus abdominis. The inferior wall is this one. The ring, let's say, the superficial ring is here. The deep ring is here, about this place. And this as the inguinal canal. And then let's say continue to introduce the muscles of the head, including the two parts.